Whenever I'm going through the Dutch test, it always comes back to the adrenals. A lot of women don't understand that they are making a lot of our androgens. When we hit menopause and our ovaries no longer make estrogen, we have to rely on our androgens from our adrenals. It is important to take care of that adrenal health, not only to preserve androgen levels, but also to preserve normal cortisol. Cortisol doesn't naturally decline as we get older. Androgens do, cortisol shouldn't.
Welcome back to another episode, ladies. We are going to talk with Dr. Kelly Ruef, who is a naturopathic doctor, and we're going to be talking all about Dutch test. So I love the Dutch test for a lot of my clients. I use it a lot, and I really want to make the Dutch test a little bit more approachable in this episode. And so I would love to just kind of dive right into why it's useful, but I would love to know why you love the Dutch test, because you must love it enough to become an advisor at Dutch. So can you kind of tell me what introduced you to it and why you love it so much?
Definitely. So the Dutch test, it stands for Dried Urine Testing for Comprehensive Hormones. And the reason I love it is probably because it's comprehensive. You know, it says it in the name, it's comprehensive, but it really gives you more information about what your hormones are doing, what your cortisol is doing. And we go into a little bit of the nutritional organic acids, a little bit like neuro-related markers, etc. But with the Dutch test, I mean, a lot of people ask me, doesn't it get really repetitive? Because I'm a clinical educator for Dutch. I do a lot of consults with providers explaining what all these markers mean and how to interpret it. And they're like, doesn't that get really repetitive for you? Doesn't it get boring? And the answer is no, because everyone is unique. Every case we talk about is different. And the Dutch test has patterns to it. Like I've looked at thousands and thousands of these Dutch tests. I've talked to thousands of providers by this point. So I've talked about thousands of cases and everyone is different. But there's patterns that we see. You know, there's patterns that we see with PCOS. And there's patterns we see when people are inflamed. It's really interesting, but I can pull up a Dutch test and I already know a little bit about that person. I'll be like, wow, it looks like they've got a lot of these hypothyroid patterns or inflammatory patterns, or I wonder if this woman has PCOS. I wonder if she's got irregular cycles. This woman looks really stressed out with gut health issues. And then when I talk to the providers, a lot of times they'll confirm that, oh yeah, she's really stressed out, she's been bloated. It's fascinating. You can get a lot of information from the Dutch test, and it is more information than you would get with a standard serum test.
I agree. And I think, well, I have a lot of favorite markers on the Dutch test, so I really can't pick one, but I will say that I do really like seeing the progesterone metabolites, especially when I'm dealing with someone who has a lot of mood swings pre-period, like a lot of PMS, a lot of PMDD even. And I find that that's a very helpful clue instead of just looking at the progesterone like you would on a blood test. So when you're thinking about running, a Dutch test, who is this for? Is it for someone who's looking for preventative health? Is it someone that's looking for, I have a ton of cycle issues? Is this only for women that are cycling? Like, who is Dutch test for?
I really think it could be for almost everyone. And the reason I say it, like, of course, if you've got PMS, irregular cycles, acne, the Dutch test can be really helpful. But even for a woman who's feeling pretty good, not, maybe pretty good energy, regular cycles, I think it can still be helpful because we look, one reason is because we look at estrogen metabolism patterns, and we can see is she metabolizing her estrogen down the healthy pathways, the healthier pathways. For example, there's a pathway, I call it the 4OH pathway. And this is the pathway that is bad. If women push too much estrogen towards 4OH, it can actually increase risk for breast cancer. And a lot of us have breast cancer in our family history. I do. I mean, my grandma had it. So for me, it's really interesting to monitor my 4OH over time and to do things to help lower the amount of 4OH that I'm producing in my body. And the nice thing is we do have research on things that help lower 4-OH. So there are actionable things I can do on a daily basis, like broccoli sprouts and fish oil and getting more organic soy in my diet and ground flax seeds and cruciferous veggies, even the carrot family veggies like carrots and celery and parsley. Those can all ensure that we're metabolizing estrogen in a healthy way.
Yeah, I agree. So I think that a lot of women will come in when they have the issues, but especially if breast cancer runs in your family, I think that I personally think that you should be running one once a year at least, just as a preventative measure to make sure that you are staying on top of everything. I mean, even I run one once a year when I'm not pregnant or, even when I'm breastfeeding, I will run it and just see like, what's going on? Are we doing what we need to do? Is everything where it needs to be? Because a little dose of prevention is so much better than, catching things later on. So do you have particular patterns that you just find really exciting about Dutch, or do you have any favorite markers that you feel like are, give a lot of insight into women's different symptoms? I know you said you see markers on there for like, oh, you're probably dealing with hypothyroidism symptoms.
Yeah, gosh, there's so many that I love, but one thing I like to look at is cortisol. We know it as the stress hormone, and with the Dutch test, we can see that diurnal pattern throughout the day. And we know cortisol should be highest in the morning, and it should be low at night before we go to bed so that we can fall asleep. But sometimes you'll see people who are really tired and their cortisol is really low throughout the day, or people who are really tired and their cortisol is really high throughout the day. We know that high cortisol, when your cortisol is high, it can lead to insulin resistance. It can make weight loss more difficult. It can lead to gut health issues, digestion issues, constipation. It can affect cardiovascular health, increase risk for heart attack, lead to insomnia issues. Like there's so much that goes on with cortisol, and I think it's important to understand where your cortisol levels are so that you can support those adrenals throughout your life and in a way prevent some of these more serious conditions, more chronic conditions. So I like the cortisol. I also like looking at the androgens, and androgens are, we call them usually the male sex hormones like testosterone and DHEA. But I personally struggled with acne for 15 years of my life, like cystic acne. And I wish I had known about the Dutch test. I just wish I would have known about testosterone testing, even in the serum. Like no one even told me that could be causing my acne. And when you look in the blood and the serum, you can look at your testosterone, you can look at your DHEA, but you only get that information. With the Dutch test, we look at the metabolites of testosterone and the metabolites of DHEA. And so we can kind of see how the body is using that testosterone and that DHEA. And for example, androgens, they can be metabolized down an alpha pathway or a beta pathway. And the alpha pathway is that more potent pathway. So let's say you had someone who had acne. They tested their testosterone in the blood. It was normal, and they hit a dead end. But let's say they took it a step further. They did the Dutch test, and they realized that their body was taking that normal testosterone, but pushing it into that potent alpha pathway. And so it was kind of activating the testosterone in a way. And so in the tissues, there was actually a lot of androgen activity, and no wonder they have acne. It might actually be from those high androgens. So that's just one example of how the metabolism patterns of the metabolites can really give you more insight that you might not be able to see with a blood test.
Yeah, I see that a lot with my clients with PCOS. And, they have all the symptoms of PCOS. Either they have unwanted hair growth or unwanted hair loss. They have really oily skin, and yet their androgens are within normal limits, but they are favoring that alpha pathway. And that is just, when you see that, it's that's one of the things where I feel like knowledge and information is such a relief, because you've been going to the doctor over and over and being told, well, your testosterone's, within normal limits, so we don't know what's going on. And so I think that can be just really insightful for them. So I'm curious, can we talk a little bit about the cortisol and the DHEA connection? Because I have been seeing, I don't know, this is just maybe Leah entering this world, but I've been seeing a lot of people for some reason, all of a sudden supplementing with DHEA because they're stressed. And they're like, oh, I should bring in DHEA and that's going to help according to my XYZ labs. But then they'll notice things like weight gain. And so can we talk a little bit about that relationship between the cortisol and the DHEA and why you need to make sure you're testing and being cautious before you start bringing in some hard-hitting supplements like that?
Yeah, that's a really, really good question. Really good topic to talk about, because I do think you're right. I think a lot of people like read up online, oh, DHEA, when you're stressed out, take DHEA, or if you want to lose weight, take DHEA, or if you want to build muscle, take DHEA. And sometimes I'll see people putting themselves on some high doses of DHEA. And one thing with the Dutch test is, we look at the cortisol, and a lot of times, not always, but a lot of times when people are stressed out, at least acutely in the beginning, they have high cortisol. And a lot of times when the adrenals are making a lot of cortisol, the adrenals are also making a lot of DHEA. And it's because it's the same signal from the brain that causes the adrenals to make both of those. So it's called ACTH. So ACTH from the brain goes to the adrenals and says, hey adrenals, make cortisol and make DHEA. And it doesn't always happen that way. It's not like clear cut, dry, like it's not always like that. But for most people that I see, when their cortisol is high, their DHEA tends to be high too. And so, if you're stressed out and you just start taking DHEA, but your DHEA is already high, you might start getting acne, you might start getting irregular cycles, heavy periods, breast tenderness, because DHEA is a pro-hormone. It converts to testosterone and it converts to estrogen. So if you start taking DHEA, it could elevate your testosterone, it could elevate your estrogen, and you could start becoming symptomatic if those elevations get too high.
Mm-hmm. Yeah. I think it's so, again, this is where Dr. Google can be not very helpful because we find this information that XYZ helps with all of these things, but this is where testing is so important, but understanding the patterns that you see on these tests, because depending on where you are in that stress cascade, like, you're in acute stress. So cortisol is high and DHEA is high. And then maybe you've been doing that for so long, the brain is like, we can't keep doing this. And then you're still really tired, but cortisol's low and DHEA is low. But we still have to go back to, what was causing that stress in the first place. And so that's where I think, having someone guide you with that test is so insightful, because you may look at it and see low cortisol and low DHEA. So obviously I should supplement with DHEA because it's low, but that's really not telling you the whole picture on what's going on. I also, speaking of DHEA converting over, can we talk about that? Why that happens with like DHEA converting to estrogen, or why testosterone would convert to estrogen? Like, why does that happen? And why that's important to kind of look at if you're looking at your Dutch test.
Yeah, that's a good question too. So DHEA, like I said, it's a pro-hormone. So it's not active. It doesn't act on hormone receptors in and of itself. It first has to convert to other hormones. And then those hormones act on receptors and have their effects. And it works a little differently in different people, depending on if they're male or female, or if they're cycling or postmenopausal. So for like a cycling woman, she makes most of her estrogen from her ovaries, you know, and what happens is right there in the ovarian cells, like testosterone is produced, androgens are produced, and then they aromatize or they convert right there in the ovary to estrogen. The ovaries are pumping out a lot of estrogen. She'll get some conversion of her testosterone and her DHEA peripherally in her body to estrogen, and that's probably more significant in women who are overweight, who are obese. If they have a lot of fat tissue, and especially if they have high androgens. Like let's say you have an obese woman with PCOS and high testosterone. She might get a significant amount of estrogen from that high testosterone converting to estrogen in her fat tissue, because the enzyme that converts androgens to estrogen is plentiful in the fat tissue. And if we have a lot of fat tissue, we have a lot more of that enzyme. But like a postmenopausal woman, most of her estrogen is just coming from the fat tissue. Her ovaries are no longer making estrogen. And that estrogen from the fat tissue, it originally comes from testosterone and DHEA. So most of a postmenopausal woman's estrogen is actually originating from the DHEA and the testosterone that's mostly made by her adrenals and a little bit still from her ovaries. And with men, a lot of their estrogen comes from that conversion of testosterone. Men have a lot more testosterone than women, and a portion of that is going to be converted to estrogen. If it gets converted too much, if men have high estrogen and low testosterone, maybe because they're inflamed or they're overweight, that's when men start getting kind of like man boobs, difficulty with erections, cholesterol issues.
That's interesting. So we keep coming back to these adrenals here in terms of, especially as you head into menopause. And I'm curious what your thoughts are, but I just feel like if we could just take care of those adrenals a little bit more, we're going to have a much smoother transition into menopause, because we just keep stressing our adrenals out, and then we go through menopause and we say, come on, adrenals, we need all of our hormones from you. Thank you very much.
Right. Oh, I 100% agree. And whenever I'm going through the Dutch test, it always comes back to the adrenals. I'm always talking about the adrenals and how important it is to support them. Because the adrenals for women, for cycling women, the adrenals are making maybe more androgens overall than the ovaries. Like the adrenals make the majority of the DHEA, and the ovaries and the adrenals make about, they both make testosterone in kind of equal parts. But the adrenals, a lot of women don't understand that they are making a lot of our androgens. And yeah, when we hit menopause and our ovaries no longer make estrogen, we have to rely on our androgens from our adrenals. We still get a little bit from our ovaries if we have them. If we haven't had a full hysterectomy, some women get their ovaries removed and then they only have androgens from their adrenals. So it is important to take care of that adrenal health, not only to preserve androgen levels, but also to preserve normal cortisol. Cortisol doesn't naturally decline as we get older. Androgens do, cortisol shouldn't.
That's very interesting. So then I'm assuming that a lot of women, maybe who have PCOS, looking at their adrenal health is needs to be a bigger topic of conversation, because if they're just looking at testosterone, they're just thinking about, insulin. But, if you have women that have really high aldosterone, really high DHEA with PCOS, they really need to be taking a much bigger look at those adrenals, is what I'm hearing.
Yes, exactly. I have a lot to say on that. I did a webinar on adrenal PCOS, and they estimate that about 30 to 50% of women with PCOS have adrenal involvement. I think it's higher. I honestly do. And one thing I found interesting when I did that presentation, I learned that some women don't sulfate well. And remember, when we're looking at DHEA in the blood, we look at the sulfated form of DHEA. And so maybe it's, sometimes it's a genetic issue. They just don't sulfate their DHEA well. So their DHEA might come back normal in the blood, but when you look at the Dutch test and you look at the DHEA metabolites, they're high because in actuality, they're making a lot of DHEA. They're just not sulfating it. And for those women, that can be a problem because the sulfated form of DHEA is not active. It's just bound up. Just bound up. But if you can't sulfate your DHEA, where else is it going to go? It's going to go to testosterone. It's going to make acne worse. It's going to make hair loss worse. It's going to convert over to estrogen.
Yeah. And that's, if you're looking at a Dutch test, I'm very visual. It's up in the, top left where your DHEA-S is.
Yeah.
Which is, crazy. So out of all the Dutch tests that I have looked at with clients, very rarely do I actually see DHEAS within a good range. It's typically always lower than the metabolites because it's just again, I'm not looking at women, again, who are robustly healthy, like they're coming to me because they don't feel good, but there's just so much inflammation that we have going on. And yeah, that's so, I wish, women with PCOS, I wish that, that this was the webinar, the class that they were able to watch, when they first get diagnosed with PCOS, because you get diagnosed with PCOS and you're told, you have this for life. And then you're also told like, oh, it's going to be really hard to have kids. It's really hard to lose weight. All of these things because you have PCOS. And they're not told that there's so many things that you can actually do to get rid of these symptoms and to feel healthy and to lose weight and to optimize your fertility. And I think it's just it's so sad because they walk out of that doctor's office, finally with an answer, but being told you can go on metformin or you can go on birth control or you can go on spironolactone, which I hate saying that word. It's so confusing to pronounce. And it's just frustrating, because they aren't given the tools and even the knowledge that there is something to be done. And so they think, this diagnosis is their life and it defines them and that's it.
I agree 100%. And the thing is, like, if they don't take birth control, it is still worth it. It's necessary to monitor their estrogen levels, their baseline estrogen levels, because if they're only ovulating twice a year, if they're ovulating at all, sometimes women have PCOS, they're only getting a period twice a year or 4 times a year. That means that they're only being, like, if they ovulate, they're only being exposed to progesterone a few times a year. And progesterone really helps with anxiety, it helps with sleep, it helps with bone mineral density, with bone health, but most importantly, it helps with endometrial protection, which just means it makes sure your uterus doesn't, you don't get cancer, uterine cancer. And I see this a lot on Dutch testing, just high baseline estrogen in women with PCOS. And they're going weeks and weeks and months with just this higher baseline estrogen and no progesterone to oppose it. And it makes sense why endometrial cancer, uterine cancer, is higher in women with PCOS. So it is important to try to regulate those cycles or at least, supplement with some progesterone.
Mm-hmm. Do you figure out how we can get that estrogen down, like bringing in those lifestyle shifts and things like that to help support that, which I think is really interesting because a lot of times when women go to get their hormones tested, if they're not cycling, and they'll come back and it's progesterone's low and they go, oh, this is the root cause of all my issues. Let me just take progesterone. And it's like, well, you aren't cycling. So if you aren't cycling, you aren't ovulating, which means you're not producing progesterone. So the root cause of your issue is actually, why are we not ovulating? And such an important, conversation to to bring up, and talk about, because if we can figure out how to support your ovulation, it's going to, obviously be incredibly life-changing for you. So besides talking about adrenals all day, what other, are there any other ones that you really want to touch on with estrogen, or do you want to kind of touch on the organic acids? I do think the organic acids are cool, but you're the expert here.
The organic acids are cool. There's a number of them that will elevate with inflammation. And that's how one way when I'm looking through a Dutch report and I see a bunch of these organic acids elevated on the last page, I'm like, wow, this person looks really inflamed. But going back to estrogen, one other metabolite that I really like is that 16-OHE1 metabolite. And it's so fascinating to me because in the research, they see it elevated, they see it preferred in autoimmune conditions like rheumatoid arthritis. They see it associated with breast cancer, and it tends to elevate with inflammation. And the 16, so if your estrogen gets converted down the 16 pathway, if your 16 gets too high, it's a proliferative estrogen. It causes a tissue growth. So imagine it binding to a receptor and causing that tissue to grow and proliferate. It can result in heavy bleeding. It can result in breast tenderness, fibrocystic breast changes. It can worsen endometriosis, fibroids. So it's a really interesting marker to look at. And I mean, it is helpful for bone health too, but we don't want it to get too high because then it could be really detrimental. And there's a lot of research on like what we can do to help lower it. For example, we know obesity pushes that pathway, pesticides push that pathway, a diet low in omega-3s and high in omega-6s pushes that pathway. Alcohol, smoking, inflammation, those all push that pathway. Hypothyroidism. And so we can do a lot of environmental medicine. We do weight loss if necessary. There's things, there's tangible things, there's actionable things we can do to help push our estrogen away from that pathway and more towards that healthy 2 pathway.
Yeah. Again, this is where I think the Dutch is more insightful than just a blood test, because if you were just going to run a blood test, you're just going to see estrogen levels and you're not going to see how your body is metabolizing them and even how methylation is. And just some simple tweaks there of like, we're going to really focus on these foods, or hey, we have to make these subtle diet changes, or we're going to bring in this supplement for a couple cycles, is such a game changer. But you would never know that if you just were looking at estrogen levels, because your estrogen levels can be within optimal ranges, but you can still be favoring, an unhealthy metabolite, an unhealthy pathway. And I just think that insight is so useful. Like, why would we not want to know that? Could we talk a little bit, really quickly, just about, weight loss? Because we talked a lot about how being overweight or having extra weight can cause actually a lot of these issues because of the fat tissue, you said, producing estrogen. But do we also come maybe full circle in terms of these levels being off, also making it harder to lose weight?
Yes, definitely. So I'll give a couple examples. So estrogen, I call it Goldilocks because it has to be just right to really help your blood sugars. If it's too high or if it's too low, you're not going to get that beneficial effect on blood sugar. Cortisol, if cortisol is too high, we're more likely to be insulin resistant. And why is that? It's because when cortisol elevates, it goes to the liver and it tells the liver to release sugar into the blood. It's like, hey, we got to run away from this tiger. Can you put some sugar in the blood so we can get away in time? So you just like chronically have high blood sugars, and insulin is what helps get the blood sugars into the cell. Because if we have high sugar in our blood, it's really not good. We can start having peripheral issues, neuropathy, issues with our eye health, our vision. So the body is wise. It's like, we don't want high sugar in the blood. This is oxidative. This is bad. Let's get it into the cells where the cells can use it. But when you have chronically high blood sugar, the cells are like, we're full. We don't want more. And so your body pumps out more and more insulin. Like, no, 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 take this sugar. And the cells are like, and that's insulin resistance. But besides that, even low cortisol, I think weight loss is more difficult with low cortisol. And androgens like DHEA, testosterone. So androgens really help us put on muscle mass and be able to exercise, be able to recover from exercise, have enough energy so we can exercise, be in a good mood so we can exercise. And we know that when we have more muscle mass, we're going to burn more calories at sitting, but we're also going to have improved insulin sensitivity. So it goes both ways.
Yeah. It's like a cycle, and it just kind of keeps going around and around, and that's where test, cut the cycle, like make the changes that you need to like actually balance those things out. And go with somebody who can really interpret your Dutch test, because it's, if you have low cortisol, at some point it was really high. So backtrack. What's going on? Figure out the things, get that support, and what you need. Do you have any other lasting words that you want to give, the listeners, women who are like, I don't know, should I run a Dutch test? Like, should I not? Anything else you want to share with us?
Yeah, I would say for some people, it's really worth it to run a Dutch test. It can be really insightful. And the thing is, we have a lot of herbs, a lot of pharmaceuticals, a lot of diet and lifestyle changes we can do to improve not only the results on the Dutch test, but more importantly, the patient's health. And so this test, I think, can be for everyone. It can be helpful for everyone. I mean, if someone's like doing really well and really healthy and no issues, no history of breast cancer, like maybe it's not the right test for them. But for the majority of us who are struggling, myself included, the Dutch test has been really insightful. And it is helpful to work with someone who knows how to interpret it. Because like I said, it is comprehensive. It can be very overwhelming, even for our providers. And so if you have someone order it for you, make sure they interpret it well. Make sure they use the Dutch resources in order to interpret it well. And even they can call us up and talk with one of the clinical educators. But for everyone, we have a lot of education on our website. It's DutchTest.com under education tab. I think there's like a Dutch news tab with a blog, tons of information. So if you're interested in learning more, you could definitely check out that page.
Yeah. And that you guys have new webinars that come out on there all the time that are very, very interesting. So if you just want to learn more about hormones, also a great place to check out.
Yep, exactly.
Well, thank you very much for hopping on.
Yeah, of course. Thanks for having me.